Good morning, Dr. Richard Buckley, MilfordMD. Our team is here. We have our fancy laser, our smart lipo triplex. It's tri because, not because we're trying it, but because there's 3 lasers in there. We're actually going to use a neodymium yttrium aluminum garnet laser this morning, a mouthful, so we say ND-YAG, and we're using one that's a 1440 ND-YAG. There are many different frequencies of ND-YAG lasers. What's the project? Project is an armpit project. Why an armpit? Because of hyperhidrosis. Sometimes I see that on the internet, H-Y-P-E-R, H-Y is not. It's H-I, hyperhidrosis, which means excessive sweating. Something in the neighborhood of maybe 3% of people have excessive sweating. It's kind of divided into 2 different kinds, primary and secondary. Primary means you got it from your parents. Thank you very much. So it's hereditary, and that usually presents itself by the age of 21. The other type is a secondary hyperhidrosis that's usually caused by some kind of medical condition or related to medical things. For example, with diabetes, with Parkinson's disease, or with medications such as naproxen, Aleve. And there are other things, but that gives you an example. So primary and secondary hyperhidrosis. Our patient today, actually, I think you said you started noticing it when you were 21?
63.
63. Okay, so that's secondary hyperhidrosis, not primary. What do we do about it? There are odds and ends of things. There are some products one can put in the armpit to try and decrease sweating. Sometimes sweating's other areas can be face, neck, it can be hands, but very commonly it's the armpits. And often people have to change their shirt, their blouse many times a day in order to not be wet. Sweating is normal under certain conditions. For example, the purpose of sweating is to cool you off. And sweat, by the way, is clear and it's odorless. It doesn't have any odor. Any odor from the armpits is from something else. It's not from the sweating. So the sweat glands make water when they want to get you cooled off. So the water evaporates, and that process of evaporation then cools your body. But what if it's cold? Well, you might be sweating anyway because you have excessive sweating, and it's unnecessary that you be sweating then. Or maybe you're nervous, or there can be many reasons for the sweating, which are not the normal reason for the sweating. That then is excessive sweating or hyperhidrosis. Now, sweating on a hot day, that's not hyperhidrosis. That's something that should happen. So our patient's bothered by his excess sweating, and a very nice thing to do, I think the best thing to do these days, and this is 2024, is to pop under the skin with a laser beam that fires not only forward but also sideways, so a side firing laser beam. And in fact, our fiber that we're going to use today is called a side laze. Very fancy name. It lasers sideways in addition to forward. What it means is I can pop under the skin through a tiny little poke that I made, and I can give a tightening treatment with the laser beam on the underside of the skin, targeting the sweat glands, specifically with our, as I said, ND-YAG 1440 laser. I deliver a particular amount of joules. They're not in the sense of sapphires or diamonds. These are units of energy. And per kind of 25 square centimeter area, so basically 5 centimeters by 5 centimeters, I might dump in between 1,000 and 1,500 joules of energy. The sweat glands are mostly in the hair-bearing area, so this is our patient's hair-bearing area, which I marked, and I've calculated roughly that those are kind of 2 5 by 5 areas, and hence I might give as much as between 2,000 and 3,000 joules of energy. I'm looking for some various endpoints. 1, the total energy, of course, but 2, that the cannula, the laser fiber, moves very smoothly. Additionally, I do like to pop under the skin when I'm finished with that lasering process with a tiny little cannula. I do have one here somewhere. This is a little cannula. It's a little scraper. it doesn't do anything to normal skin, but when I put it under the skin, I can scrape the underside of those lasered sweat glands and further irritate them and get them scraped off of there. My experience with the procedure is it works really well and our patients are really happy. I'm not sure that one can very often say, oh, you know, one time it's going to take care of whatever kind of a thing we're working on, but my experience with this Precision TX Smart Lipo Triplex laser treatment, the way we do it, along with the curetting, the scraping of the underside of the hair-bearing part of the armpit, I find it to be very effective. It's a quick and easy procedure. It's easy enough for us, although we're well tooled up and you have to know what to do with the tools, and it's easy for our patient. I've numbed this area and I'm going to show you the laser. Can you hit the start button there for me, please? And can you put us in ready mode all the way down to the bottom? Ready? Yep. So we're waiting for our laser to get fully up. I don't know if you can see it on my glove. That went off a second here, it'll come back on. Can you zoom in on the glove? There is some light that comes out the end of my laser fiber. It's the targeting light. So, and that's a Heine beam, it's helium and neon. If you look very carefully on my glove, you can see there's a linear line-ish part there, and then there's a little dot there. The dot on my hand is where that laser is looking to fire sideways. The linear part on my hand is the part that's going to shoot straight forward. So you can see that to the side of the laser, so it's by me now, that's, and I'm moving it, that's the part that I'm going to have underneath the skin. That part is a little thing called the chevron right here, some lines, and I keep that chevron up, which means that beam is pointing towards my thumb up, and if I'm underneath the skin, as I will be through my tiny little poke hole here, I just popped underneath the skin. Now I can start laying down energy. And press the start button. Press ready again. Press, no. A lot of the lasers are not happy if you dally before you start. Press OK. Okay, maybe we're live. You can hear a popping sound. Please zoom in on that. Maybe even get closer to me. That popping sound is fat cells and the sweat glands giving up the ghost. Patients' eyes are protected with some metal shields. Staff eyes are protected with goggles that specifically protect against the frequency of laser that we're currently using. So it's not just any goggles are good. The right goggles are good. The ones we're wearing now have an optical density of 5 for the frequency we're using, which is an appropriate thing. You comfortable?
My arm is killing me.
It's killing you because you have trouble keeping it in that position.
Yes.
Nothing to do with the procedure.
Nothing to do with the procedure.
Yeah, I just want to make that clarification. So it's another interesting thing we find out about our patients during procedures. You know, they have some back issues, they have knee issues, they have hip issues, they have neck issues, and more frequently than not, if there is any thing that our patient's uncomfortable about, it's the positioning relative to ongoing chronic conditions that they have. The treatment in the armpit is totally comfortable though. Yes? Yeah. Now the good news is this doesn't take very long. So we're going to be able to get our patient's arm back down in just a couple of minutes. And so he'll be comfortable. So that is treatment of hyperhidrosis in our patient's armpits. He's awake, as you heard. And yeah, that's kind of it. There's no downtime and nothing specific he needs to do afterwards. Thank you for watching. Milford, MD.